Good afternoon, everyone. My name is Stephen Atherton, coming to you today regarding psychological disorders and therapy specifically for adolescents. Now, the system, no matter how intellectual and profound, is broken. The system can mean many things to many people, but in this instance, it's referencing psychological disorders, the therapy associated, and the issues within. At every level of psychotherapy, there is what seems to be a united front of love and care for the patients associated. Even within this context, the most heartfelt, I could help you, I can help you, is lost if the therapy administered is lacking in the help being spoken of. It's necessary, specifically regarding adolescents, to dive into not only the concept of therapy for said adolescents, but also a few of the therapies being utilized to understand what's occurring instead of the potential speculation. According to the research administered, even with the best intentions, there's a lack of solid understanding on the grounds of helping adolescents with psychological disorders. It's necessary to expose these downfalls, learn from the lack of training, and take steps forward towards more detailed, in-depth understanding of the disorders at play and how to assist within that. So within the context of psychological disorders, there's a growing need to understand this category regarding adolescents. With a consistently growing number of adolescents struggling with these disorders, it's necessary to utilize methodologies to assist the needs of the generation at hand. According to Medline Plus, a government health institution, common types of mental health disorders plaguing our country are anxiety disorders, including panic disorder, obsessive compulsive disorder, and phobias of all kinds. Depression, bipolar, and other mood disorders are among these types of things. Eating disorders, personality disorders, post-traumatic stress disorders, and psychotic disorders, including schizophrenia. Medline 2021. Understanding the vast numbers of mental disorders is key to moving forward with the conversation. If a basic understanding of this topic is acknowledged, then a basic package of treatments will be available. Each individual disorder differs drastically from the next, making it more vital than ever to understand, work through these treatments. And with the individuals needing assistance in this area. To make it even more complicated and necessary to evaluate, we return to the idea of not just mental health disorders in our country, but mental health disorders among young people and the necessity to adjust treatments even more for the sake of these individuals. Desiring to understand this topic and assist where possible. In 2002, B. Vickers wrote a paper titled Cognitive Behavioral Therapy for Adolescents with Psychological Disorders that addresses this topic in a way that opens the doors to new advancements in the field being discussed. The paper takes the research conducted of adolescents against the CBT system to see its effectiveness. To understand this concept, the process of CBT must be understood. Cognitive behavioral therapy is a structured, collaborative psychotherapy which emphasizes the link between thoughts, feelings, and behavior in maintaining psychological disorders. Over the last decade, CBT techniques have been shown to have a robust efficacy in studies with the child and adolescent population, and more recently when delivered as group interventions for young people. From the research done in therapeutic techniques utilized, adolescents tested through these trials showed great results in several realms of mental health disorders spoken of previously. Even with great success, there are always potential bumps in the road. Even though success may have occurred in these studies, an acknowledgement of potential relapse and nonconformity to the newly established therapy must be processed. Not to mention the need of continued therapy after success has occurred. ensuring proper treatment for disorders after success. CBT may, in fact, be a robust therapy for adolescents. The question remains, what's next? And does this treatment work for all mental health disorders that adolescents struggle with? In the context of psychological disorders therapy in adolescence, it's necessary to look at a specific disorder, or the effectiveness of CBT, which in turn will inform processes and procedures for this specific disorder from the information provided. Panic disorder is one that plagues so many in the adolescent community for so many reasons. Panic disorder is experienced by about 1% of adolescents and has a significant impact on social and academic functioning. Preliminary evidence supports the effectiveness of panic disorder-specific treatment in adolescents with panic disorder. However, panic disorder may be overlooked in adolescents due to overlapping symptoms with other anxiety disorders and other difficulties being more noticeable to others. It's necessary in any disorder to think through the 3 depression lens. True imbalance causing said disorder, situations creating the state of disorder, and lastly, attention seeking within the context of a disorder. All are serious as each has a root cause. No matter the type, the effects of these disorders are real. Specifically speaking into that of panic disorder, H.J. Baker's paper, The Identification and Psychological Treatment of Panic Disorder in Adolescents, a survey of CAMHS clinicians, brings into play the crippling truths of panic disorder and the effects on adolescent age individuals. This paper takes the time to look at cognitive behavioral therapy within the context of panic disorder in adolescents, bringing to light the use of this specific therapy alongside others. The conclusion being most professionals utilizing CBT within the realm of panic disorder have a lack of positive results, and within this, a plea for more training to assist with panic disorder and potentially more methodologies to assist moving forward. There's an acknowledgement within the psychotherapy world that one size does not fit all, as it is clearly seen within the remarkable positive results reported by Vickers and the negative responses specifically regarding panic disorder reported by Baker. It's necessary to deeper processing, as stated previously, into the concepts, treatments, and philosophies surrounding mental disorders in adolescence. If the psychotherapy world simply utilized what was available with mixed results, it's a failure to the community at large. So again, the question is presented of what is next? What needs to happen to better these individuals struggling in desperate need of assistance when the assistance they are receiving just will not do? From the previous assertions, it's necessary to evaluate other forms of therapy within the constructs of, again, specific groups within the context of mental disorder. From this, there should be, at the very least, a more detailed understanding of these specific therapies' positive or negative effects, potentially being able to connect dots from one disorder to another with these different therapies in view. In the paper, The Mystery of the Well-Attained Group, a model of personal construct therapy for adolescents, self-harm, and depression in community CAMHS service by H. Moran, reveals the need to discover potential therapy for individuals struggling with self-harm, specifically females, bringing into play another aspect of mental disorders needing to be addressed that may not be able to be simply placing this specific group in a CBT category. This is what he says. One of the significant issues in modern child and adolescent mental health services, CAMHS, is how to manage the increasing demand for psychological therapies for depression and self-harm in teenage girls in accordance with National Institute for Health and Clinical Excellence guidelines. Referrals for self-harm and depression, either separately or comorbid, are frequent, and early intervention is important. Research has found that girls are particularly vulnerable to depression, with females showing 2 to 3 times higher levels of depressive symptoms than males from 13 years into adulthood. The research into this specific topic took place with a group of girls dealing with the above disorders. One of the therapies used in this trial is called forced introspection, which bringing these girls face to face with the issues at hand and the necessity to understand what they're doing and why. The biggest piece to the puzzle regarding the therapy utilized within this context was the end goal of having those in trial understand ways to combat the need for self-harm, work through the situation versus harming themselves as a response. On paper, this seems to be an incredible opportunity to not only force realization of the issues at hand, in turn handing the individuals tools for success. However, on paper, finality that a situation is cured due to a process or procedure is inconsistent with the fact in these specific situations. The facts are the results were not fully conclusive. Even though positive at some angles, the research needed more. The introduction of a group for adolescent girls with depression, self-harm, and comorbid problems has proved to be possible using personal construct therapy. The model of therapy is focused upon girls developing their potential, understanding of their own symptoms, and then finding their own ways to tackle them. This individualized approach within a group has been feasible, but it needs more evaluation and comparison within therapies at more formal level to provide or prove its value. This was Moran in 2009. Seeing progress in a specific area can be encouraging for those in the field of psychotherapy. However, there should never be a moment where a lackadaisical approach is taken. Even in success, potential of failure and reevaluation must always be on the doorstep for the sake of those being assisted. Each therapy utilized in its context being willing to also evaluate other therapies that may be of better assistance. All in all, there are pros and cons to each therapy regarding adolescents, the struggles they deal with in the realm of mental disorders, and the application to the therapies associated with these specific disorders. A massive piece of the puzzle that must be understood and evaluated is the need for more. The need for more training, the need for more comprehensive studies, the need for more individuals willing to step into the fold, work with the issues at hand, realizing the people being worked with are in fact people, not the disease they suffer from. Each therapy utilized must stay in its lane with the willingness to approach each case from a different angle for the sake of the individual afflicted.